Bismillahirrahmanirrahim. Dear students, welcome to my new lecture session. So in this lecture we will discuss about the nursing intervention for thrombolytic therapy. Dear student, as we know that thrombolytic agents, so before studying the nursing intervention for thrombolytic agents, we should know about a little bit about the clinical pharmacology of thrombolytic agents. So thrombolytic agents are those agents which can promote the clot resolution, the process of activating the plasmin system to break down the thrombus or clot that is being formed. The pharmacological action of thrombolytic agents, actually they are responsible to convert the plasminogen to plasmin and the body natural anti-clotting system. Thrombolytic agent action to activate this promote breakdown of the fibrin threads and dissolution of formed clots. It is also very necessary to prevent the vessel occlusion and therefore to deliver the adequate blood flow to the body system. So why thrombolytic agents are used? Whenever there is a clot formation at the level of blood vessels, so these thrombolytic agents, so they are responsible to deliver, it can enhance the blood flow to the body system. The clinical indication for thrombolytic agents, so they are used for the treatment of acute myocardial infarctions whenever there is occurred death at the level of the segment of the myocardium muscles, whenever there is a chance of pulmonary embolism and acute ischemic stroke. They are also indicated for the clearing of the occluded intravenous catheter and central venous access devices, which I have already explained in my previous lecture. Especially in case of children, they are not indicated for this group age. While in case of adult, this drug should be used with precautions and particularly important to prevent the injury, for example using the electric razor and soft bristle toothbrush. It is also important that adults they are educated on what to do. It should be especially bleeding when bleeding occurs. For example, applying the firm pressure as well as what sign of bleeding should be watched out for. Other drugs taken should be documented because there are a lot of drug interaction with these drug class, and it should also be emphasized that the periodic blood test is expected to monitor the effect of therapy. Especially in case of pregnant women, these thrombolytic agents, they are not advisable. Only the benefit to the mother would clearly outweigh the risk for the patient. On the other hand, especially for lactating women, it is generally inadvisable. In case of older adults or geriatrics, so they are more susceptible to the drug toxicity and drug-drug interactions. This drug should be used with careful monitoring. Careful monitoring of the liver and kidney function is important for this age group. As we know that normally the physiology or the basic function of different organs of geriatric patients, so they are weak. So that's why their drug response is also weak and they are more susceptible to the drug toxicity. Therefore, it is always started at the lowest level possible and adjusted accordingly. Come to the pharmacokinetics of the thrombolytic agent. So it can be administered through intravenous IV route and its onset of action is immediate and its peak is end of injection. So mean it can start the pharmacological action with no time delay. Its half-life is unknown, metabolisms and the plasmin excretion is unknown. Contraindication and caution. So allergy to thrombolytics, especially it can prevent the severe hypersensitivity reaction and non-bleeding disorder, recent trauma in surgery, acute liver disease, cardiovascular accident within 2 months and gastrointestinal ulcers, and these conditions can affect the normal clotting factor and normal plasminogen productions. Thrombolytic agents, they cannot be used especially in pregnancy as well as in lactation and potentials as well as in potential adverse effect to the fetus or neonates. Potential adverse effects in neonates or fetus, they are reported, so this drug should be stopped. The AD or adverse drug effect which are reported on the cardiovascular system, it may be in the form cardiac arrhythmia and hypertension may be occurs. Bleeding is the most common AD or adverse drug reaction of thrombolytic agents, and hypersensitivity reaction, which is uncommon and characterized by the rash, flushing and spasms. As well as there are certain interaction, and it shouldn't be used in a combination with anticoagulant, antiplatelets, because it can increase the risk of bleeding. Now come toward the nursing consideration. Now what are the basic responsibility of the nurses? So here important nursing consideration when administering thrombolytics, nursing assessment. So before nursing assessment, so he or she is also responsible that have a strong command about the knowledge of the drug, about its use, about its indication, contraindication, about its toxicity. So these are the important things that the nurse should include in the conducting assessment, history taking and examination. Assess for the mentioned contraindication to the drug like hypersensitivity, acute liver disease and cardiovascular accident within 2 months. It should be checked to prevent the potential adverse effects. He or she should conduct thoroughly physical assessment before beginning drug therapy to establish the baseline status, determine effectivity of the therapy and evaluate the potential adverse effects. He or she should obtain the baseline status for complete blood count, fecal occult blood test and clotting studies to determine any potential adverse effects. Nursing diagnosis. Here are some of the nursing diagnoses that can be formulated in the use of this drug for therapy. Decrease the cardiac output related to cardiac arrhythmias and potential for bleedings. Risk for injury related to clot dissolving effects. These are the nursing diagnoses. I'm sure that nurses not only responsible, nurses responsible for monitoring, while all the healthcare professionals they are responsible to manage such type of cases, clinical cases collaboratively. Implementation with rationales. Implementation with rationale, this is also you can say these are vital nursing interventions which is done in patients who are taking thrombolytics. For example, if the patient who is taking thrombolytics, so what are the basic fundamentals, cares, role and responsibility of the nurses to implement with rationales? First of all, he or she should assess for the signs signifying the blood loss, for example petechias, bruises, dark color stools, etc., to determine the therapy effectiveness and promote the prompt intervention for bleeding episodes. He or she should also establish the safety precautions, for example, rising side rails, ensuring adequate room lighting, feeding side of the bed to protect the patient from the injury. While he or she should also evaluate the effectiveness by monitoring the coagulation studies to adjust the drug dose appropriately. Nurse is also responsible to educate the patient on the drug therapy, including the drug name, its indication, adverse effect, to watch out for the enhanced patient understanding on drug therapy and therefore promote adherence to the drug regimes. So you should also educate the patient regarding the use of different type of medications. How the evaluations can be done. So here are some aspects of care that should be evaluated to determine the effectiveness of drug therapy. The nurse should monitor the patient response to therapy, resolutions of the blood clot and return of the blood flow. Monitor for adverse effects like bleeding, anemias and hypertension, so it must be recorded. To evaluate the patient understanding on the drug therapy by asking the patient to the name of the drug and indication, adverse effect to watch for. This is also very important. You should educate the patient regarding the drug therapy, and then you should ask a question from the patient that which medication, which drug you are used and for which conditions, especially in the ADR which are reported. That's why the knowledge about drug, this is much more important. After that you can assist the patient. You should also, he or she should also monitor the patient compliance to the drug therapy, either the patient has exactly followed the medication or not. At the end of my lecture, so I am very thankful to my dedicated teacher, dedicated to my beloved mentor, Professor Dr. Shazeb Sif. So currently he is working as a assistant professor at University of Malakand Pharmacy Department. So I'm very thankful to all of you, especially to my students, and this lecture is dedicated to my beloved mentor, Professor Dr. Shazeb Sif. He's a very loving and caring person, and thank you so much for watching my lectures.